Welcome to Taking Charge of My Cancer podcast, episode 26. I am Derly Munoz, your host, and I have a very special guest today, Shelley-Schaitel. Shelley is an oncology-certified RN with a bachelor's degree. She has been working in 12 different oncology clinics across southern Wisconsin for almost 13 years. During that time, she was diagnosed and treated for breast cancer. She discovered that she carried a genetic mutation, BRCA1, that caused her to be at high risk for multiple cancers, including breast, ovarian, uterine, pancreatic, and melanoma. After her experience with cancer, she found her level of understanding and compassion for her oncology patients to be above and beyond what she thought would be possible. She has clinical knowledge, but more important, personal experience to support you during this new and confusing chapter of life. Few doctors, surgeons, or nurses have the actual cancer experience to share with their patients. So her goal is to remove the stigma of negativity associated with cancer by guiding her clients towards a positive perception. In essence, inspiring light in total darkness. She wants to encourage you to tell cancer who is the boss, and I love that. I was like so great when she sent me this, and that was like awesome. So Shelley, thank you so much for being here and welcome to the podcast.
Thank you for having me. And it is one of my favorite statements. Being an oncology nurse it actually has made it past the 13 years now. It's one of my favorite statements to just leave a patient with when they leave the space that we're in, just because I just tend to see too many people hearing the word cancer and then cancer it consumes them and they become cancer versus the person that they once were. They're still that same person, and I want to consider that person and make them be the person they continued to be before cancer. So that's the goal.
Awesome. You want to tell us about how did you become a nurse in oncology and maybe a little bit of a story about your breast cancer?
Kind of funny story. I actually went to nursing school after my first baby thinking I was going to go and be an OB delivery nurse, and I never once landed there. And it just, everything that my nursing career landed me right to where I was in oncology, from just the skill sets to just working in endoscopy and seeing cancers physically through scoping. And then also working in group therapy, which was also a huge benefit to know that everybody has a story to tell, and really working on listening, because people want to tell their story. And sometimes that's part of the healing process in my eyes.
And so were you ever planning to do nursing, or you ever thought to do something else?
I never had a clue that I was going to be a nurse until I had met my first nurse after I delivered my first son. And that experience is always so scary because you have no idea what you're doing. You're a brand new mom. You have this new baby that you're responsible for. And she did such a great job educating me. And I felt so much better walking away from my experience. And that led me to just wanting to be a nurse, period. And that's an important piece of what we are to do in healthcare settings, and it's getting harder and harder for us to do that with the time that we have available to us. So that's a super important piece that I will always remember, and that's why I became a nurse. And then I was led to oncology and became my baby, and I never left.
That's awesome. You want to tell us a little bit your story about your cancer?
So interestingly enough, I was due for a mammogram, but I postponed it by 1 month because I was actively moving. We were in the process, and I said, okay, that's fine. I had to move of house and job. So I had a little bit of things from insurance to just, life that I was working on. So I waited a month. But I actually happened to wake up one morning and had just an itch. And again, it's one of those things, I don't believe that there's mistakes or that there's not something that happens, that we find these moments. And I had this itch and I went to itch it and I found this, I was like, what is that? It was a lump. And I thought, wait a minute, what's going on here? And of course, being an oncology nurse, I investigated and found that I was a BRCA1 and also carried the BRCA1 and then had breast cancer, and ended up having, multiple surgeries and chemotherapy and all that medical, physical things.
Got you. Would you give us 3 valuable tips that you learned in your journey? You can give me 3 valuable things from the nursing aspect and then as a cancer survivor aspect of it.
Let's see. From nursing aspect, for me, it's huge important for people to get second opinions. We oftentimes have just been trained in our brain that these doctors know everything, and God bless them for having the intelligence that they have. But it's really important to get second opinions because, there is good and bad in everywhere. And you have to make sure you feel comfortable with the scenario you are being put in and the doctor and staff that you're working with. So that's one of my biggest, most important things. If you're somebody who's not super into medicine, which I have found a lot of people been, quote unquote, non-compliant, but we've never really had the time to ask them maybe why they weren't taking certain medications, whether it was cost or side effects or whatever it might be. It might have been a heritage belief that they don't want to take medication, but being able to have alternative options that could potentially help them with their symptoms, when it comes to, nausea and ginger, or just, there's so many different things out there, and there's so many gifts besides just your Western medicine that can be super valuable, and being open-minded to different options is key. A third one is, I highly encourage people to document. I was a big advocate in myself. I was even medical, but I wrote down everything on a calendar so I could keep track of myself and what it was experiencing, because especially with chemotherapy, everything's super cyclical, and you can better plan your life around chemo instead of, well, I don't know how I'm going to feel, so I'm going to just stay home and seclude myself, rather than, man, I'm going to live my life, and I want to go and I want to do the things I want to do, and I want to enjoy each day, because we are not promised tomorrow.
Yep.
So that's huge with medical and kind of a personal level. Personally, knowing that there is no such thing as perfect, being stripped of your hair, your eyebrows, your eyelashes, and in my case, even my boobs and my uterus and all these other body parts that were removed, kind of made you realize that you had this other person behind all these things that you wear, right? So just practicing every day about not being perfect. When we were talking even before this podcast, I said, if I make a blooper, can we edit that? And the more we talked, it's like, you know what, you're right. If I make a mess up, God bless that I'm human. And thank you for, reminding me of that practice that I'm doing.
Absolutely.
Yeah. Number 2 would be, I'm not selfish if I think of myself. It's hard for me not to be, because I'm a nurse, I had to like switch gears and be the patient. Holy Hannah, that was a transition I couldn't even explain to anybody what that would be like. And to actually think of myself and accept the gifts that were coming towards me.
Yeah, that's amazing.
That was tricky.
Yes.
To accept the gifts and to encourage others to do the same.
Absolutely. Yeah.
And third and most important to me is we all have to continue to love everyone, including ourselves.
Mm-hmm.
So that was a big one as well. I learned to accept me and all my faults, even if I don't look at them as faults, but to just love myself, because the more I love myself, the more I was able to give to others, and I was able to exude a whole different light. I mean, I had a light, but boy, did it get brighter.
Yes, and now that you mentioned this, I've been a PT for many years, like 33 years, and in oncology for the last 14. And the one thing that totally, so in the beginning, when I had the opportunity to start working with oncology patients, and I was like, man, I really don't have an idea what to do with oncology, right? I was doing ortho, sports medicine, I really don't know. And so I'm like, well, let me look, but they were looking for somebody who was able to kind of lead a program and grow a program. And so I came and started shadow my colleagues. And I totally fall in love with you guys, patients, within the first 2 weeks. Because in my mind was, I don't know, I'm very emotional. So I see you crying, and here I am crying, and I just met you not long ago. And then I'm like, how I'm gonna handle this, right? I don't really, I need to be strong for them, and I'm gonna start crying with them. And then it's like, and then I'm such a high energy, pushy, and I was thinking in the back of my head, cancer patients, they really, I have to take it easy. They cannot really push themselves, they're going to feel sorry for themselves, like totally this kind of like thinking I had in my head. And the first week I was shadowing my colleague, treating patients in oncology, I was like, amazed me of the energy and, the love for life. Like, it's like, who cares that I'm sick and I'm throwing up, and hang on a second, I'm going to the bathroom and I come back, and what do you want me to do next? Like the more compliant patients ever. And I totally fall in love with it. I'm like, oh my God, I really don't know much about oncology at that point, but I totally love this population. And
Yeah,
I don't regret it. I've been loving the last 14 years of my career doing this. And it's amazing. And the more I know, the more I get to know you guys. It's just really, the perspective of life changed so much. And even
it's
though
true.
I
It's
have not
true.
been touched, I mean, my father-in-law died from lung cancer, but besides that, I have never been touched by any close, family member that had cancer. But I just learned not to complain, right? Like, why do I complain about having a little neck pain when I have seen these patients who go through so much and they're so
Right.
strong that I'm like, oh, come on, I have nothing to complain about my life when other
You're
people
right.
really seeing things differently. So that really change your expectation, like you say, about life and
Yep.
about living the moment and live every day like the last day, no matter what you have and what kind of prognosis you have. So
Correct.
yeah, so it's absolutely kind of feel you there from, the medical standpoint or from like the professional standpoint.
Mm-hmm.
How about the more painful lesson as well from the nursing standpoint and from your personal experience?
My most painful lesson is in all honesty, I love the medical field. I went into it for a reason. I learned so much. I think my most painful lesson is I didn't take the time to investigate and make, the choices that I wanted to make for myself. I definitely went with guidance, of course, because I had the knowledge to make the right choices. However, if we step back and breathe for a minute and actually look at the whole picture about quality of life versus quantity, I think that there's a piece of that I missed. And I think most people do, because we oftentimes just get in that space and we just do what we're told. And we don't actually listen to either our own intuition or our own, like, what does it look like for my family in the long run when maybe I'll strip, some people worry about money, and that's a big deal, and then they're putting their family into debt, and that's more stress. So sometimes we have to step back and decide, is this the right thing for us medically or not? Or, do I do part of this or do I try that? But you can't go back. So for me, there's some of that was like, I should have spent a little more time just breathing and thinking about what this looks like long term, and to make sure that I was making the best choices for quality of life versus quantity. And that's just for me. Not everybody's might feel that way. A lot of people have been taught that we are warriors because we get chemo, we get radiation, we get surgeries, we get all these things. And yes, we are warriors for all those reasons, but we can also be warriors to step back and maybe not do any of that. I've seen it. And I feel like that takes more guts than any one of us that go in and do all these crazy surgeries and radiation and chemos, because it takes a lot of guts to say, you know what, I'm going to step back and let the universe speak, or God, or whatever your belief might be. And my time will be my time, regardless of what we do with our bodies here on this earth, and to be a little more humane. That's, I guess, one of my biggest pain points. And I want to encourage those that follow me through this journey to really investigate their own self.
Yep.
And to find what works for them and their families.
Yep.
And mostly them, because you sometimes listen to the family and you don't make the right choices for you because you're worried about your kids, or you're worried about your spouse, or you're worried about your parents or siblings.
Absolutely.
But thinking about you during that, it's your story. It's nobody else's book but your own.
So that take me into, were you able to have like a good interdisciplinary team, like where you have your care, like you have physical therapy, you have nurse navigator? How was your experience with that?
For me, when it comes to personally, I feel like I got pretty, God bless it, good care. When it comes to the navigators and the doctors and the nurses and physical therapy and the surgeons, you know, there is a little bit of the political stuff that, you know, this is a little tricky when it comes to when you're in certain areas, we make decisions off of insurance. And that's why I'm kind of glad I knew what I knew, because it was like, well, I know that they're going to guide me towards this surgeon, but do your investigation. And I wanted to know who I'm dealing with. And after I did some investigating, I was glad that I went outside what my insurance company would cover. So, you know, I'm sorry, I kind of went off track with that. I lost track of the question with that part, but I definitely felt like I wanted to spend time not just making decisions off of what the insurance companies were telling me to do, but to investigate and find the best option for, you know, surgery, for example. You could really be in a world of hurt, and it's worth every penny of debt to walk away and not have maybe a high infection rate because of
Yep, absolutely.
the conditions. So I personally had some great care, and I have worked in several different clinics, and I can say that it's not like that everywhere. Whether it's a smaller based place where they just don't have the ability to accommodate, or some doctors that maybe are questionable that
Yep.
I have seen and worked with, that again, we have to be mindful and definitely take the time to investigate and do the best we can for you.
Got you. Do you have any lymph nodes removed?
Well, luckily, you know, back in the day, they used to remove like a whole bunch of lymph nodes, and that was just what we did. And luckily, in my time, we can just do the first sentinel lymph node, and that was negative. So thankfully, I was blessed with that being completely negative at the time. But there was a lot to do with physical therapy on that left side that was affected. And I definitely encourage physical therapy when it comes to even just, you know, scar massage and getting in there and again, moving your arms and doing all those. I did exercises like religiously. They're not just telling you to do those things for their health. They're doing it so you can actually continue to gain what you had before. And oftentimes people fall off that train and don't fall. I feel like physical therapy was probably one of the best things offered. We also had a wonderful cancer boot camp. I have been preaching to people to get some exercise for a million years, right? In nursing. And I'm like, hey, go get some exercise. And they're looking at me like, are you kidding me? I'm getting chemo. But I'm telling you, I was practicing what I preached. I wanted to be like, I'm not going to be a hypocrite. I'm going to go ahead and do this. and I go to these boot camps. Sometimes I didn't know which end things were going to come out, but I'd take a break for a minute and take a breath, get some water, and it would usually pass. And I'd make jokes about it, and the girls were laughing at me because I said, well, hold on a minute. I don't know which end things might come out. You just didn't ever know what was going to happen. But I always ended up walking out feeling better. So I proved the theory that, to get your energy, you have got to get out there and move. And this is just about anybody, not just cancer patients. This is movement in general. If we stop moving, everything in your body will pay.
And now that you mentioned that, for years, and as a nurse in oncology, I'm sure that you've been on those places where patients are going and getting infusions. But yeah, something that we've been kind of really encouraged quite a bit is like really exercising for everything. So again, more studies showing exercise will decrease your cancer risk to beginning with, your cancer recurrence, just really mitigate all of those cancer secondary effects like cancer-related fatigue, right?
Yep.
And sometimes, increasing oxygen with exercise prior to chemotherapy and radiation will maybe improve the effectiveness of those chemotherapies and radiotherapy.
Right.
So when I work here at UF in Gainesville, we do see patients prior to infusion. So they come in and we do a really high interval training for when they can.
Oh, nice.
And
That's
then we do that
wonderful.
right before they go upstairs for infusion. And what I'm finding is all those secondary effects of nausea, fatigue really decrease quite a bit. And really, they have so much better outcomes throughout the whole thing because we just follow them through the whole thing. So that really makes a difference. So it's not just PT after the fact that you have your surgery, but if we can do pre-rehab, if we can start to really do pre-baseline measurements to make sure that we monitor lymphedema, so we have a baseline and we have something to compare to afterward. Then
wow,
we
isn't that something?
early onset. So we have a really strong prospective surveillance, lymphedema surveillance program. So we're able to really identify lymphedema early on so we can reverse it. And we do the same thing for our head and neck cancer patients. So I think the education and getting a patient engaged even prior to any treatment already, and start to train them if they never did any exercise, but we can start to bring them when they have none of those effects yet. That really makes a lot easier for them to continue on when they start experiencing the fatigue or any of other effects coming from either chemo or radiation. So that's super encouraged. I'm so glad that you were really encouraging that. And that's what we really talk about patients. And, sometimes I tell the physicians, don't tell a patient, or some of the radiation oncologists, like, they tell the patient, just take it easy. It's like, no, you don't tell them to take it easy. No, absolutely not. Because they're gonna come to us and we're not gonna take it easy. Like, no, they gotta continue moving, and you be smart about it. You're getting radiation, you don't want to be on the beach in the sun.
Right.
But you want to continue moving. That's super important. So I'm glad that you did that and that was able to help you through your journey.
Well, yeah, and is also to prove a theory. We've been doing this and talking about this, and actually be able to valuably say, yeah, that really did make a difference, and now I can speak for it. That's the key. Is I've been my own guinea pig the entire time, because yeah, you knew it, you preached it, and you can read all the stuff in the books all you want, right?
Yeah.
But when you're actually walking that path and you're the one in that, and you're like, okay, well, this is what I've been telling people. And most people can be pretty good about, following through with things, and others struggle with it. But if you can just tell people, you have two choices. You can have a good journey or you can have a bad one.
Mm-hmm.
And most people do not have to look like the movies. Most people can actually go out and do what they need to do and enjoy life with cancer and all these things. However, you have to do some things for yourself.
Yep.
Nobody else can do it for you.
Exactly.
Nobody else can do it for you.
Absolutely.
And so that's also getting into the mind. And so I also practiced yoga and meditation. And I'm telling you, there is something to be said about, when people are anxious or depressed, when we start to look inside of our minds, when we're noticing that, to to change that way of thinking. It's all in a mindset too. It
Yep.
really can be a mindset piece that oftentimes it can be considered this toxic positivity, but I don't believe that's true. I believe that we have a way of manifesting what we're going to get.
Yep.
And if we can alleviate those anxieties in the very beginning, wow, the journey looks so different, because now we've gotten into your head and we now don't see, oh, I'm going to get sick and I'm going to be nauseous and vomiting, all these things. There's a potential, but if we take our medicines and we take our ginger, or we do these things to help ourselves, we may not have any of these problems at all.
Yep.
In
Absolutely.
addition to our mindset.
Yep.
So it's just like a whole wonderful piece. It's not just a body that we are treating, where we should be able to treat a body, mind, and spirit. And that is one of Sparkling Survivor's goals. Because we are getting so busy in the healthcare setting that it's harder and harder for us to have these moments with people.
Yeah.
And I miss that. So I wanted to start this business for that very reason.
Okay, and that's actually lead me to the next question. How can people find you, and tell us a little bit about your business?
So I'm just going to read for a minute just so I don't miss anything, because I always mess this up. But basically, Sparkling Survivor is a healthcare concierge, combining science and spirituality, as well as Eastern and Western medicine, to create an individualized, holistic cancer experience. Plus, your consultant can advocate, navigate, collaborate with your team, educate, and in my case, I can relate. So the goal is Sparkling Survivor is an independent cancer consulting that gets to know the person and family faced with a cancer diagnosis. And in turn, we together can create an individualized package to allow the person to receive much needed anxiety reducing and positive support needed to find light in the darkness of the disease. With me being able to offer my personal and professional knowledge, it helps me be able to guide somebody diagnosed with cancer to make the right decisions for them. So I'm able to offer my service with my experience professionally and personally. But then I also included a concierge piece, which I was excited about, because there's so many valuable things out there that insurance companies don't get involved with, that I feel can be extremely valuable in helping people through their journey. And this is not limited to what I speak of right now, but it's also, I wanted to support small businesses. There's a lot of great small business owners that do these things, such as yoga, meditation, massage, Reiki, sound, equine, and pet methods of healing. We can heal somebody spiritually if they're having struggles with that and they're headed down we're not going to be able to heal your body. You are going to eventually face hospice and palliation and working with supporting their symptoms. So I think that these valuable tools can help you if you're going to live with cancer or if you're going to die with cancer. And it can be endless. There's so many gifts out there that we have, and I've been finding even writing. I have met a lady who I can connect people to be able to be in writers' workshops or art, or just any way that looks to therapeutically help them through their journey. And I don't think the insurance companies can even get involved with that, because we are busy treating that person with the chemos and radiations and surgeries. So just thinking outside the box.
That's amazing. That's so great. I'm so glad you're doing that. And that was part of why I started this podcast, because I wanted to kind of bring everybody who from different aspects of it. It's not just the typical surgeon, medical oncology, radiation oncology, but this whole world of like mental health, nutrition, exercise, spiritual health, all these other things, physical medicine, like to try to really bring all the pieces of a puzzle to try to really help out our audience through their journey. So that's amazing. That's great.
Yeah, and speaking of nutrition, I do have that availability too, just because like I said, some smaller clinics, you don't have the ability to get a hold of like a nutritionist or what have you. So I do have that as well.
Okay, great. And then I will, on the podcast description, I will put your social information so people find you that way. Is
That'd be
anything
great.
else you would like to share with us before I let you go?
Not really. I think a lot was talked about. I think the biggest thing is when I say tell cancer who's boss, what that really means is don't let cancer tell you what you're going to do with your last chapter, if it's your last chapter or if it's the middle chapter. Allow that to be an opportunity to look at yourself and your life and what you've done and what you want to do, because you're still writing that book. You have an opportunity to continue to write the book until you don't. And each day is a gift, and continue to write your book and tell cancer who's boss.
That's amazing. Thank you so much. That was super fun. I really appreciate you being here with us today.
Thank you so much for having me. It was a great pleasure of mine.
Okay, you have a great evening.
Thank you. You too.
Bye.
Bye.